Hi, I'm Lisa Marie, and this is my doctor, Dr. Richard DeCenso.
Hello.
How are you today?
Wonderful.
Great. Today I wanted to interview about the condition that I saw you for. I had some hair loss and some weight gain a couple of years ago, and so I heard of you through a friend, and she mentioned that you might be able to help me. And the reason that she thought you would help me is because you practice a little bit differently than most conventional doctors. Can you tell me a little bit about that?
Yes. Essentially, my whole practice is based on what I call the whole person concept. So in other words, instead of just looking at your symptoms, I take into consideration the physical aspect of your experience, the biochemical aspect of your experience, but also what I call the virtual aspect, or the psychological, emotional, perhaps spiritual aspects that contribute to the symptoms and experiences that people have in life.
Wow. Okay, so when I came to you, it was August of 2011, and I was feeling depressed because I, didn't have any hair and didn't have the physical body that I was hoping to get with all the exercising that I was doing. And I came to you, and you evaluated me with a test that is a little bit different than what I've encountered in the past. You checked my blood and my urine and my saliva, and checked the pH balance of my organs in my body. And from that, you were able to prescribe me supplements, and it's probably within a couple of weeks, I noticed I felt like I had more energy, and some of those symptoms started getting alleviated right away, and then some others, like the hair loss, hasn't quite gone away yet. My experience with you has been wonderful overall, and it's greatly alleviated some of the stress and some of the concerns of nobody being able to help me. And I had tried other avenues for many, many years. So thank you so much for that. And I wanted to ask, what is your opinion of why I was having those experiences, and how you were able to treat me with just supplements?
Well, we were using a process called the matrix assessment profile. And so what we're doing is assessing the matrix, the human matrix being composed of the physical experience, biochemical experience, and the psychological, emotional, spiritual experience. So we're not just looking at your symptoms, we're looking at the things that can accumulate in terms of imbalances and deficiencies in the biological fluids that can cause or contribute to physical symptoms, and then correlating those imbalances and deficiencies to what you're experiencing, and then targeting our treatment protocols toward those imbalances and deficiencies, and then the net result should be that what you're experiencing should improve or disappear.
It seems so simple.
It is simple. I'm a simple guy, and I need to understand it that way. But I had a lot of help. Some of the basic information came from people as far back as Louis Pasteur, and as recent as NASA developing evaluation processes for the Apollo moon astronauts. Wow,
that's really awesome. I'm so glad that you have this technology available. I've actually sent all of my friends and family to you.
Yes. Thank you.
You're welcome. And some of them have a lot of complaints and a lot of symptoms, and then others haven't really had any symptoms but wanted to just maintain their health or make sure they were okay. What have you found as far as that goes? Is it okay just to come into you if you don't have a lot of symptoms?
That would be the best time.
Oh, really?
Yeah, because fortunately with this tool and this technology, we're able to see things in the process of developing before they become symptoms that progress into diseases. So that's the best time to come.
Oh, great. So if I'm a college student and maybe I have a lot of tests or exams and some pressures with that, but I'm pretty healthy other than that, you can help with that kind of thing as well?
Yeah, because what you're going to see in the course of the evaluation is where the stress is.
Oh.
All right, and anytime you're going through a testing procedure, learning process, anytime you're being held accountable for information over a period of time, Even if you're in a job that's a high-stress job, you're going to see what impact that stress has on different systems in the body, and we're going to be able to target how to address that, the cause and the effects of that stress, so that we minimize the impact and minimize the possibility of that long-term exposure to stress turning into physical symptoms.
Like mine.
Like yours.
Okay, wow, that's really great. And if somebody has already experienced symptoms for a long time, like maybe even fibromyalgia or something as awful as cancer, those type of situations, you're able to evaluate them and help them as well?
Absolutely, because we can see to what degree the imbalances and deficiencies have progressed, how long they've been there, what the impact has been on certain areas of the body, and then we can ascertain what kind of approach is appropriate to stabilize that environment and then reverse the effects of those underlying causes.
Wow.
And protect them from relapsing back into that same experience, because as you know, I rarely consider any of these things that you just described to be actual diseases. They're really actually names for things that people are experiencing. Arthritis, I include diabetes in that. I include all of the conventional disorders and diseases, things like IBS. Okay, those are not diseases.
So it's a symptom.
They're a symptom of an imbalance or a deficiency. And so the key is to identify the cause that's associated with those symptoms and address it at that level.
Wow. So you really can take anybody's symptoms and turn it into a solution and
Correct.
figure out how to get them on the path to healing.
Yeah, that's my whole objective, is to look beyond the name, the diagnosis, to look at the causal factors in the biochemistry that are known to be related to the progression of certain disorders and diseases and symptom complexes, and intervene, interrupt, stabilize, reverse, eliminate.
That is awesome. Well, I sure feel much more confident in my life knowing that no matter what health concern that arises in my life or in my loved ones, that I have you to help me with.
Yes,
all of those things. So thank you very much.
You're welcome. As I've said before, I couldn't do this without you. The reality is that I'm a guide, and that if you don't act on the information that's provided to you, then you're going to get no results. So you're actually the one doing it. So I thank you.
Oh, thank you very much. And thanks so much for doing this interview with me today.
You're very welcome. My pleasure.